Do you remember the first time you felt your body respond and didn't quite know why? That sudden rush, the warmth, the pulse that seemed to have a life of its own? What's happening inside is more than just physics. It's a quiet conversation between nerves, blood, hormones, and memory. Today we're going to walk through that conversation. What unfolds in the body during sexual arousal, and what the clitoris really is, in a way that feels honest, respectful, and simple to understand. Imagine your body as a well-practiced orchestra, a sight, a touch, a memory. Even a whisper can be the conductor's cue. The first movement is the signal, the brain. Sensory input, eyes, ears, skin, and thoughts travel to the brain where emotion and past experience add color. The hypothalamus and limbic system, the emotional centers, send out chemical messengers. That's the moment desire begins to feel real, not just in your head, but in your body. Next, the body's wiring takes over. Nerves carry electric messages from the brain down the spinal cord and out to the pelvis. At the same time, the autonomic nervous system, which runs many automatic functions, shifts gears. Blood vessels in the genital area dilate. That increased blood flow causes tissues to swell and become more sensitive. It's why things feel fuller, warmer, and often more tender. For many people, the breath quickens, the heart beats faster, and muscles prepare, readying us for possible intimacy. Now, let's talk about the clitoris, often misunderstood, sometimes overlooked, but central to the female sexual response. If you imagine a tiny button, that's only the visible tip. The clitoris is actually a much larger structure that extends deep inside the body. It has a visible glans, a hood, and internal arms, like two wishbones that curl along the pelvic bones. It's packed with nerve endings, far more than any other part of the genitals, which explains why stimulation there can produce intense pleasure. Here's a simple picture. Like an iceberg, most of the clitoris is hidden beneath the surface. The external part you can see is just the tip. Most of it lies under the skin and wraps around the vaginal canal. That's why stimulation that feels indirect, through touch, pressure, or movement, can still be powerful. For many seniors, understanding this hidden anatomy can change the way they think about pleasure and intimacy. Hormones also play a quiet but influential part. Testosterone, estrogen, oxytocin. These chemical players rise and fall with age, health, medication, and life events. They don't decide everything, but they shape how easily arousal happens and how strongly sensations register. That's why changes in libido or response are common and normal as we get older. They aren't failures. They're signals that your body's orchestra has a slightly different score now. Let me tell you about Rosa, 62, who thought intimacy would always feel awkward after menopause. She told us she stopped trying because nothing worked the way it used to. After learning about how blood flow and nerve sensitivity change, she and her partner started with small experiments, longer foreplay, softer touch, and pauses to check in. It wasn't instant fireworks. It was a gentle rediscovery. Over weeks, she noticed more consistent arousal and a type of pleasure she hadn't expected, calmer, deeper, and emotionally richer. That's the real point. Arousal can change in texture without vanishing. One of the most important truths is that arousal is both local and whole body. Local because the clitoris, vulva, and surrounding tissues are directly involved. Whole body because breathing, muscle tension, emotions, and safety all influence how arousal unfolds. If someone feels rushed, anxious, or judged, the body's brakes tighten. If they feel relaxed, connected, and safe, the accelerator works more smoothly. Simple things, a warm room, eye contact, a reassuring touch, often matter as much as any technique. There are practical ways to support arousal at any age. Start with curiosity instead of pressure. Explore what feels good without aiming for a specific outcome. Slow things down. Longer foreplay raises blood flow and sensitivity. Try different types of touch, light, rhythmic, firm, circular. And remember, the clitoris responds to a variety of sensations. Use lubrication when things feel dry. It reduces discomfort and makes stimulation more pleasant. Communication is essential. Asking, "Do you like this?" or "Is this too much?" invites connection and helps both partners learn. Medical factors matter too. Some medications, health conditions, or surgeries can influence nerve function, blood flow, or hormones. If arousal or sensation change significantly, it's reasonable to speak with a healthcare provider who understands sexual health. Small adjustments, different meds, pelvic floor therapy, or targeted treatments can sometimes help, but many people find meaningful improvement through behavioral changes alone: better sleep, managing stress, gentle exercise to improve circulation, and keeping conversations about intimacy alive. A few surprises people often don't expect. First, sensitivity can increase with gentle, persistent attention. Second, pleasure that used to be fast and intense may evolve into pleasure that builds slowly and feels more connected. And third, most seniors discover that emotional closeness, trust, and a lack of pressure can make the physical sensations far more satisfying than in earlier decades. Before I close, a quick note for anyone watching: what works for one person may not work for another, and that's okay. If you're comfortable, tell me your age in the comments and where you're watching from. Have you noticed changes in desire or sensation with age? What helped you reconnect? Sharing helps others feel they're not alone, and I'll read your stories. If you found this helpful, please tap like and subscribe. We make content like this regularly. And share with a friend who might appreciate a respectful, science-based take on intimacy later in life. A brief reminder: this video explains general patterns and possibilities. It's not a substitute for medical advice. If you're experiencing pain, sudden changes, or concerns about your sexual health, please consult a healthcare professional. The most compassionate truth is this: our capacity for pleasure doesn't have an expiration date. It changes, it adapts, and with a little patience and curiosity, many people discover new and meaningful experiences. What you feel is valid. What you enjoy matters. And the next time your body listens to that quiet conductor, you'll be a little more prepared to hear the music.